Hi, welcome to Dr. Ted Talks. I'm going to talk to you today about facial rejuvenation. This is one of the very common procedures we do at Estique Medical Center and has various components. We'll discuss the face lifting procedure today and talk about the various complementary procedures that can be done either non-surgically or surgically. The facelift itself really takes care of three areas. And I can demonstrate them on myself very easily because I'm getting ready to do this myself. A parenthesis from the nasolabial fold to the jowl is what's lifted. Sometimes the jowl area and the skin around the neck, bringing it up in this fashion. We all do this on ourself in the mirrors. What it doesn't take care of are the eyelids, upper and lower, or position of the brow. This can be something you can add or what's not necessary to add, or can be done at a second stage or simultaneously. Let's just stick with the facelift for now, and let's talk about where the incisions go. I'm going to go to our touch and we'll talk about the facelifting procedure. The incisions for a facelift are variable. I like using a very small incision and literally stay out of your hair. So you can see, and I'll trace here, the incision line will go along the hairline, then in front of the ear, back behind the ear, and from this aspect of this incision in front, we can move this area forward as well as this area. We can come behind the ear, and then I bevel the incision along the hairline in the back. This will enable me to tighten the skin of the neck as well. So that would take care of the three areas of bringing this up, and the neck, so we can clean the neck position. Sometimes, depending on how lax the neck is, I might have to make a small incision in this area under the chin, which is virtually invisible, to really get that area further. 56 years old. She has fullness in here. She has some jowling, and she has laxity in her neck. So these are the three areas that are going to be taken care of a facelift. So now let's look at her. Now her eyelids aren't bad. The eyebrows are in a correct position. She has the eyelid full above. She has a little bit of hollowness about the upper eyelids, and sometimes a little crepiness, which we can do a chemical peel to soften. She really doesn't need her eyelids done themselves. So let's look at her after just doing the facelift with a light peel around the eyes. You can see we're not trying to make her look like she's in a wind tunnel. We just want a natural, refreshed look. So she's softer around the fold here. She gets a more heart-shaped face here, and her neck is cleaner. You can appreciate the neck a little bit better on the side view. Here she is on the side, where we can get the neck cleaner or sharper jawline. And you can see her incision lines look a little bit pink around her ear. That's because she's only 2.5 weeks after the operation. I tell people usually in about 2 weeks, you can be back in the public eye without anybody knowing you did anything. You might need a little bit of makeup over the incision lines. Now let's take a look at this young lady. You can see her on the top. She has some jowling, parenthesis, and some laxity of the neck. Let's look at her on the side. You can see here where the jowling comes across her jawline and into the neck, which is what we want to clear. Here she is now after, before and after on the front. She gets a more heart-shaped face with a cleaner neck. And here she is on the side. If you look at her, she's in her late 40s. She really has a lot of sun damage to her skin. Her eyebrows are in the correct position. She has an upper eyelid fold. She has some crepiness, as you can see the wrinkling of her lower eyelids. A lot of skin damage where she has pigmentation around her skin, also on the forehead. And she has wrinkling around her mouth, the lipstick bleed lines. Now, what we did on her was the facelift, got her on a good skincare program, and then did a peel, a chemical peel, and I like a phenylcroton peel around the eyelids and the forehead, and literally around her entire face. This is her at 3 weeks post-op with makeup on. You can see the texture of the skin and color is better with her using good, appropriate, aggressive skincare that we use at Estique at our medical spa. You can see this will get better and better as time goes on as well. She gets a more heart-shaped face. The wrinkles around her mouth are markedly improved, as are the crepiness of her eyelids. So she gets a cleaner neck, sharper jawline, less jowls, the parentheses are back, and it just gives her an overall refreshed, natural look. Probably 20 years ago, the average age I did a facelift on was about 58 to 62. Now the average facelift has come down by a decade. It's usually about 48 to 52. And you can see this young lady who's 47 years old really doesn't look bad at all. She looks she's very attractive. What she's not liking is the area where she's getting jowling here in this area and jowling here. And you can see as we age and the jowls come out, it makes the face look square rather than that heart-shaped look that we like. So you can see how she improves her heart-shaped face. So we get rid of that jowling and it cleans her neck as well. A cleaner neckline here. Her jowls are improved here and her folds back. You can see a little pinkness around the incision in front of her ear and under this sideburn here. Again, she's 2 weeks post-op. Now look at this young woman. She has laxity around her upper eyelids. She has tear troughs under her eyes. She doesn't have bagginess, but tear troughs where you can see a U around the eye here. She gets a U under there, which we like to eliminate. Just doing the facelift or even doing her eyelids is not going to eliminate that. She does have the parenthesis. She does have jowling and laxity around her neck and the lipstick bleed lines around her mouth. So what we're going to do her eyelids. We did her upper eyelids where we're removing that excess of skin. On the face, we're going to do the traditional facelift where we're elevating up the cheeks, the jaw lines, peeling around her mouth, as you've seen before. But now we're going to add another dimension, which I think is one of the most exciting things in plastic surgery. Now we're going to take fat out of a part of her body she doesn't want, and in real time prepare that. And through just needlepoint injections here, here, and here, we'll again very finely put fat in across her lower eyelid to blend out that tear trough and build up her cheeks as well at the time of tightening. Here she is after, and this is 3 weeks after. You can see her upper eyelids, her fold is restored. She has a beautiful blend from her lower lid to her cheek. She has restorative the heart-shaped face with cleaning of the neck and smoothness around the mouth from the peel. The power now is we can use good aggressive skincare to prepare the skin and help rejuvenate it. We can use the peeling to help the fine wrinkling around the eyelids and mouth. We use the lifting to improve the parenthesis, the jowls, and around the neck, and then use the fat to fill in around the eyelids and the cheek. And the other bonus we see some from the fat is because we call it the stem cell effect, is the skin actually becomes much more radiant. Even as great as our skincare products do, this is that on steroids. It really gives it a blend and a radiance and a vibrance. Welcome back. Well, I know we covered a lot of material here, but the whole entire facial rejuvenation is a compilation of different things that you can do. In the medical spa, we can use Botox and fillers and aggressive skincare. We can use PRP, which is platelet-rich plasma, to utilize with microneedling. Then when you get to the point where it's taking a step further, we can dial in the surgical modalities that we have. I look forward to hearing from you, and stay well, stay safe, and stay positive. Thank you.